Without oxygen being passed from the lungs to the bloodstream, then pumped around the body by the heart, you will die. When a person suffers cardiac arrest, their heart stops beating, they lose consciousness, stop breathing, and blood will not circulate. Unless they receive prompt first aid attention until medical help arrives, they will suffer irreparable brain damage and then die within minutes. In this program, we show the technique that should be employed in performing cardiopulmonary resuscitation only on an adult. We are therefore assuming that you have a general knowledge of first aid principles. CPR is a technique that can save lives when performed correctly. Simply put, CPR is the technique of rescue breathing in conjunction with chest compressions. CPR involves the squashing of the heart between the breastbone and the backbone. This, combined with breathing into the casualty's airway, usually the mouth, can supply oxygen to the lungs and to the circulating blood. Obviously, squashing the heart is the only way a rescuer can keep the heart performing its function of pumping and circulating blood around the body. The air we breathe in contains about 21% oxygen, and the air we breathe out contains about 16 to 18% oxygen. Therefore, breathing into a casualty's airway lets the rescuer supply the necessary oxygen to the casualty. Before commencing CPR, the following basic life support steps must always be completed. Check to make sure there is no immediate or further danger to the rescuer, other personnel, or the casualty. Check for a response. Try to wake the casualty. Raise an alarm and call 911 immediately and see if the casualty is breathing. If the casualty is breathing normally, place them in the recovery position. Wait for medical attention to arrive and monitor their condition regularly. If the casualty is not breathing normally, you will have to immediately commence CPR. For demonstration purposes, we will use this mannequin. First, you should kneel alongside the casualty in a position that will allow you to comfortably apply vertical pressure during compressions. Next, visualize where the center of the casualty's chest is. Then, place the heel of one hand on that point in the center of the chest. This achieves our aim of placing the heel of one hand on the chest above the heart. Keep that hand in position and place the heel of the other hand on top of the first hand and interlock the fingers of the hands like this. Alternatively, you can grasp around the wrist of the first hand like this. Either method is acceptable. Be sure not to apply any pressure over the casualty's ribs, abdomen, or the bottom end of their sternum, as this can cause damage to internal organs. When performing compressions, you should pivot from the hips. That is, you should not be rocking back and forth. Position yourself so that you are directly above the casualty's chest. Your compressing arm should be kept straight. Your bottom hand should remain in contact with the casualty's chest, and your shoulder will be directly above the chest when compressions are delivered. Compressions should be rhythmic, with equal time for compression and relaxation. And you should allow the chest to recoil completely after each compression. With an adult casualty, each compression should depress the chest 1.5 to 2 inches. Compressions should be delivered at a rate of 100 compressions per minute. After 30 chest compressions are given, check that the casualty's airway is clear. Next, 2 rescue breaths should be delivered. Make sure the casualty's head is tilted back. Place the palm of one